Welcome and thank you for joining today's webinar. When outbreaks occur, the reproductive health needs of women and girls do not stop. The global launch of operational guidance for sexual, reproductive, maternal, and newborn health services and infectious disease outbreaks. This webinar is hosted by the READY Initiative in collaboration with the Interagency Working Group on Reproductive Health and Crisis, and funded by the Bureau of Humanitarian Assistance. We are happy to provide live interpretation into French, Spanish, and Arabic for today's webinar. If you are interested in listening to this session in one of these languages, please click the globe icon that says interpretation at the bottom of your Zoom screen and select your desired language. During this webinar, we encourage you to ask questions using the Q&A function, and access to today's recording will be available on the READY website. It is now my pleasure to turn it over to our moderator, Maria, the Senior Humanitarian Advisor in Reproductive Health at Save the Children and Technical Advisor for READY. Maria.
Thank you. Thank you very much, Pasika, for the introduction and for guiding us in the logistics of this webinar today. So without further ado, I want to welcome and thank all of you around the world for making time, first of all, to join our webinar today. It is truly an honor to be in this virtual room with every one of you and kind of hold hands to continue working together for reproductive health needs of women and girls. We are a community, so please go ahead and use the chat as a whiteboard for introduction. Since we are not together in a room, find this space and introduce yourself, your organization, and maybe which country you are working, or any other thoughts you might want to share with this community during this webinar. As you all know, our purpose in this next hour is to officially launch and introduce you to what you see here on the screen, the two new operational guidance documents on sexual and reproductive health and rights, and maternal and newborn health during infectious disease outbreaks. They look the same. There's a slight color difference. They are both developed for operational purposes, and we will have more time to discuss and share more about these guidances in the next hour. So let me walk you through a little bit our agenda today, so we know what we're going to be listening, who's going to be here with us, and what we'll be doing the next hour. We will start with an interactive activity, actually, with a Mentimeter to elevate your voices and together discover the challenges and need for maintaining reproductive health services during an infectious disease outbreak. This will be followed by a brief overview of the two resources we are sharing with the world today. And we will then have a panel discussion on how the guidance documents can help to address challenges women and girls have in accessing sexual, reproductive, maternal, and newborn health in preparedness and response phase to an infectious disease outbreak. As you can see in the agenda, we will also have a little bit of time for question and answers from audience. Fasika already mentioned you can use the actual function to do so at the bottom of your Zoom screen, and we will do our best to respond during this webinar, recognizing our limited time today together. We hope you will enjoy the next hour and discover more detailed answers in the two guidances we are here to share with you today, as we will not be able to really go through the very details of them. With that in mind, let me take a few seconds to introduce you to the panelists. It will be great if the group we are here today to discuss and share experiences with you come on and share their faces on camera. So I will start with Janet Meyer, a senior humanitarian advisor for reproductive health, working with Save the Children International, who is a teammate and work colleague for many years now with me. So Janet, would you like to say hi and come forward with your camera?
Hi, everyone. Very nice to be part of this webinar and very excited about introducing the guidance documents.
Thank you
Thanks,
very
Maria.
much. Alison Greer, Senior Advisor from the Interagency Working Group for Reproductive Health and Humanitarian Settings. Alison, would you like to say hi as well?
Hello, everyone. And again, thank you for having me here. It's a pleasure.
Thank you, Alison. And we have Fatima Gohar from the Maternal, Newborn and Adolescent Health Specialist working with UNICEF. Fatima?
Hello, everyone. Happy to be here.
Thank you. And we have Dr. Abusi Shaheen calling from Bangladesh, which is quite late now. So thank you, Dr. Shaheen. He's a senior health coordinator with the International Rescue Committee. Can you come also like in camera to introduce yourself?
Yeah, I'm in the camera. So hello to everyone, global, every participant, and I'm pleased to be here. Thank you very much.
Thank you very much, Dr. Shaheen. And Rina Kaya Atuma from Kenya, who is a health system strengthening technical officer at the Population Refugee Reference Bureau in Kenya. So Rina.
Hi, everyone. My name is Rina, and I'm glad to be here.
We are very happy to have you. Okay, so before we go further into our agenda, I would like to take a very quick time to introduce READY initiative for those that they didn't have the chance to know the initiative already. So yes, the READY initiative began in 2018 and is funded by the Bureau for Humanitarian Assistance from USAID. We are a consortium of partners with Save the Children as the lead, the Center for Humanitarian Health from Johns Hopkins University, the Center for Communication Programs, the UK Med, and the Humanitarian Leadership Academy. Our goal in READY initiative is for NGOs, local and international, to have the tools, knowledge, and skills to support crisis-affected communities and local authorities to effectively respond to major epidemics and pandemics in humanitarian settings. And we do this on a global level, producing the needed guidance, tools, trainings, etc. You can access actually more information, trainings, and other resources in our website, which I believe Fasika and Laura will be sharing with you today in the chat right now. Feel free, what I usually do is bookmark them because we all forget after webinars. So this is an opportunity to bookmark it. With that in mind, I will pass the microphone to Alison to introduce quickly also the Interagency Working Group for Reproductive Health in Humanitarian Settings.
Hello, everyone, once again. The Interagency Working Group on Reproductive Health and Crises, known as IWOG, is a collaborative global coalition of individual and organizational members. Our greatest strength is our dedicated and diverse membership. IWOG's purpose is to provide unified leadership to improve policy, strengthen practice, mobilize resources, and promote accountability to advance the sexual and reproductive health and rights of people affected by humanitarian crises. The coalition was formed in 1995 at a time when sexual and reproductive health services in humanitarian settings were virtually non-existent. And for nearly 3 decades now, IWOG has led the charge to institutionalize sexual and reproductive health and rights into humanitarian response. IWOG is the only coalition convening, coordinating, and supporting implementers, advocates, policymakers, and researchers who are operating in the humanitarian, sexual, and reproductive health space through its programmatic and policy guidance, advocacy, research, and communities of practice. Next slide, please. So how does IWOG work? The coalition brings together humanitarian and development leaders to work on a comprehensive range of sexual and reproductive health and rights issues. It is led by a steering committee, and our members advance a shared agenda through participation in sub-working groups and task teams representing technical and cross-cutting areas of focus. For more information, please visit our website and contact the IWOG Secretariat team at the email address on this slide. Thank you so much for your time.
Thank you very much, Alison. And now we'll pass the microphone to Janet, who will discuss about the GAP and the guidances and actually officially launch them to the world. So Thank you, Janet, for continuing the presentation.
So we will be talking about some of the challenges to ensuring women and girls have access to sexual, reproductive, maternal, and newborn health services in an infectious disease outbreak. And there are many different excellent resources, including ones from IWAG that are pictured on this slide. The Minimum Initial Service Package for Reproductive Health, also known as the MISP, is pictured in the center. That is the cheat sheet. And the Interagency Field Manual on the left that includes information on the MISP and the maternal and newborn health are both included in the field manual. And the Newborn Health in Humanitarian Settings Field Guide, which is also known as the Newborn Field Guide. But there are gaps in these and other guidance on the provision of reproductive health services in infectious disease outbreaks. Next slide. So to address these gaps, the READY Initiative, in collaboration with IWAG and other partners, developed these two resources. Pictured on the left is the Sexual and Reproductive Health and Rights During Infectious Disease Outbreaks, Operational Guidance for Humanitarian and Fragile Settings, that was developed in collaboration with the International Rescue Committee. On the right is pictured the Maternal and Newborn Health During Infectious Disease Outbreaks, Operational Guidance for Humanitarian and Fragile Settings. These two guidance are complementary to one another, as well as to the IWAG resources that were just highlighted. While these guidance documents focus on humanitarian and crisis settings, they apply to infectious disease outbreaks in all low resource settings. Next. Before presenting each document, I would like to take a step back to highlight the purpose of focusing on sexual, reproductive, maternal, and newborn health. These services are life-saving, essential, and time-critical. Access to these services in humanitarian settings is often limited, even though approximately 1 in 4 people needing humanitarian assistance are women and girls of reproductive age. Infectious disease outbreaks can disrupt and cause health systems to collapse as resources are diverted to the outbreak response. Pregnant women and newborns are at increased risk of severe and prolonged illness for certain infectious diseases due to their physiological and immune function. So this hazardous dynamic leads to both direct mortality from the infectious disease and indirect mortality from preventable and treatable conditions. Next. The SRHR During Infectious Disease Outbreaks Operational Guidance provides practical advice for health staff undertaking infectious disease preparedness and response activities. It supports health actors to maintain critical sexual and reproductive health services during an outbreak and ensures necessary considerations are integrated within the outbreak response. This guidance is for program managers and healthcare providers from implementing partner agencies and governments in fragile settings and any other setting that are at risk of experiencing infectious disease outbreaks. Next. The guidance is divided into 4 sections along with 2 annexes. Section 1 explores the effects of infectious disease outbreaks on sexual and reproductive health, such as increased morbidity and mortality, increased risk of gender-based violence, and reduced access to essential services, among others. An additional noteworthy effect is that women frequently take on the role as caregivers, which puts them at increased risk of infection. These effects on sexual and reproductive health highlight the importance of taking specific actions before and during an infectious disease outbreak to ensure continuation of these services. Services are organized according to the MISP, which is a priority set of activities to respond to sexual and reproductive health needs in all acute emergency responses. and linked to the pillars of an infectious disease response. Section 2 explores a number of cross-cutting considerations, such as coordination, respectful client-centered care, and staff health and well-being. Section 3 focuses on the maintenance and continuity of essential sexual and reproductive health services during outbreaks, including clinical service provision, making clinical services safe, expanding community-based and self-care, and risk communication and community engagement. Section 4 is focused on integrating sexual and reproductive health needs within infectious disease outbreak response pillars, such as triage and testing and case management at treatment centers. Next. So pictured here is Annex 1. I know you can't really read the slide, but just to show that this annex contains 2 checklists that look at the preparedness and response actions that can be undertaken. The top one is based on the MISP, and the second one is based on the infectious disease response pillars. Examples of infectious disease response pillars are coordination, infection prevention and control, logistics and surveillance, among others. There are 6 MISP objectives that are aimed at reducing mortality and morbidity. Some examples of these objectives are coordination, prevention and response to sexual violence, preventing transmission and managing sexually transmitted infections, including HIV, and reducing excess maternal and newborn mortality and morbidity. And there are an additional 2 objectives there. Next slide. And just to mention, those checklists are meant to be easy to use for a program manager to help them in prioritizing activities for preparedness and response. So in Annex 2, there are additional tools and resources that may be very helpful. These are organized by categories such as infectious disease general guidance and disease-specific resources, among others. Next. So the guidance is available online in English, Spanish, French, and Arabic. Now we can go to the next document. Next slide. So the second guidance, maternal and newborn health during infectious disease outbreaks, is also an operational guidance for humanitarian and fragile settings, and aims to provide actors responsible for maternal and newborn health programming with actions to maintain the continuity, quality, and safety of healthcare for pregnant and postnatal women and adolescent girls and their newborns. Maternal newborn health in this guidance document includes antenatal care, care during childbirth, postnatal care for mother and baby, and emergency obstetric and newborn care. Next. The structure is similar to the other guidance. Section 1 explores the effects of infectious disease outbreaks on maternal and newborn health. Some important effects include reduced access to essential services due to reasons such as movement restrictions, health facility closures, or diversion of healthcare workers to the infectious disease response itself. Other important effects include delays in care-seeking behavior due to fears of becoming infected, unnecessary separation of mothers and newborns and interruption of breastfeeding. Signs of pregnancy complication might also be confused with signs of the infectious disease of concern, and women may be given harmful or inappropriate care. So Section 2 then goes over the outbreak response pillars and examples of maternal and newborn health activities by pillar, which is pictured here on the left. It also reviews maternal and newborn health MISP priority actions, assessment and expansion to comprehensive maternal and newborn health services, emergency obstetric and newborn care, care for small and or sick newborns, family planning and reproductive health services, and case management. Section 3 speaks to community-based maternal and newborn health services, And section 4 talks about cross-cutting considerations for maternal and newborn care. Next. So Annex 1, again, includes an easy-to-use checklist looking at the preparedness and response actions that can be undertaken for maternal and newborn health programming. There are 2 sections: maintaining essential maternal and newborn health services during infectious disease outbreaks. And section 2 is cross-cutting considerations for maternal and newborn health during an infectious disease outbreak. Next. Annex 2 contains breastfeeding recommendations by common pathogens transmitted through respiratory, bodily fluids, and waterborne modes of transmission. Next. This guidance is also available online and in the same languages as the other one. And it will also soon be available as an annex to the newborn field guide that I referenced earlier. So that is a quick overview of the 2 guidance documents. So please feel free to post any questions you have about the guidance in the Q&A or chat boxes, and we will respond to them. Thank you.
Thank you very much, Janet. I was overexcited to go straight to the introduction that we did not go to the interactive exercise. So now this is a good time to actually share with you a link. So Fasika will help us with the monitor and share on the chat the link. We would like you to go in the link you see in the chat on Mentimeter and name 1 challenge you have faced maintaining reproductive health services for women and girls during an infectious disease outbreak. As you start writing your responses, we will all see see in the webinar here. I would also like to utilize this time with our with a great guests and panelists. So how about starting with Dr. Sahin? Dr. Sahin, can you come forward and share 1 challenge with us from your own setting?
Yeah, thank you, Maria. So the challenge we face, the biggest challenge here in Cox's Bazar to control the transmission of COVID-19 during the last pandemic. The government issued the directives that basically prohibit, restrict any GV services in the Rohingya camps. So that basically hinder the implementation of MIPS comprehensively within the camp. Thank you.
Thank you very much. And Rina, could you also to share a quick challenge from Kenya?
Yes, challenges are quite a number, but if I have to mention one of the challenges that we face on maintaining reproductive health services for women and girls during an infectious disease outbreak, working in a program that is already looking at HIV prevention, care and treatment, reproductive and maternal and child health. They are all, there's a continuous challenge that we face within facilities that are not able to keep proper records of their stock of the available commodities. And this is very risky, especially if you're talking about readiness and you don't know when the next outbreak will be and how much stock will you have. So that has been a major challenge. Thank you.
Thank you very much, Rina. And Fatima, from your end?
Yes, so as Rina said, challenges are enormous. So, but let me just focus on one big challenge, what I have seen throughout these years of my experience, which is the lack of integration of SRM and CAH services in the national disaster or preparedness plans or response plans. And even if in countries where it has been included, but there's no capacity for the managers for them to adequately implement it. Over.
Thank you very much. Thank you very much for this very important highlight. And we see the challenges coming from your side. I think we'll go back to Rina's words about the long list that it's out there for women and girls, especially during disease outbreak, and the difficulties like to do our work, like especially from the community of reproductive health frontline workers. We see women also not willing to meet the health workers for ANC. We see lack of required supplies, as you also mentioned, Rina. We see like health facility accessibility, diversion of funds to the disease outbreak. And I hope like by the end of this, like you also like keep the link and like look at the challenges, and hopefully like this operational guidance will provide some practical solutions, some ideas on how to overcome them during preparedness and response phase. This was like the main reason like for this challenge, for these guidances to be developed. And without further ado, we can continue with the discussion with Rina and Dr. Sahin and Fatima with a few questions we have for them that will help us look a little bit closer to the guidelines. So I want to start like with the challenge that Dr. Sahin mentioned. You mentioned about the challenge of control of transmission within the context of Bangladesh Cox's Bazar. Would you like to elaborate a little bit more on that, and how will the challenge you mentioned be addressed within your guidance?
Yeah, as I mentioned that the government, in fact, told to suspend all that is the GBV services. So it was hard to continue integrated SRS and GBV services in this context. So, that is, if we look at that to implement the comprehensive MISP, so then it was a huge challenge. But one of the good thing is that the SRE's working group and also the health sector come very strongly to advocate Bangladesh government, especially the Refugee Relief and Repatriation Commissioner, to convince them so that they can basically lift off the restriction on the GV services, integrated GV services. So I think the government lifted off that restriction in September 2021. But I strongly believe if we had this kind of guidance documents, what we can basically take recommendation and with support from this kind of guidance to convince and sensitize the government authority to allow to roll out the full comprehensive MISP during any outbreak situation. So I think it could be a great resource for the advocacy in the future time. Yeah, thank you. Over to you, Maria.
Thank you very much for like addressing and putting a lot of different chapters and guidance that it's there in the two guidance we are sharing, especially mentioning coordination. And we are all like from my side, having worked in Bangladesh as well. Like I know how the SRH coordination, like a strong like network there has contributed like in advocacy at the Ministry of Health level. So this is like a very great point. I would also like to extend the same question like to Rina, but before going to that, I wanted to say that Rina from Kenya was one of the first participants at the pilot training we started like earlier this year to introduce the guidances, a very interactive scenario-based pilot training of 4 to 5 days that we started with Kenya. So Rina was one of the people that experienced this training. So she might like also have like more information or more like sharing from the guidances and how she experienced. I wanted to ask Rina about her challenge. You mentioned the challenge of commodities. So how do you feel this challenge you mentioned will be addressed within your guidance?
Before going to the question, I'll talk about even outside an outbreak. We all understand that sometimes commodities are scarce, and when talking about commodities, I'm talking about maternal and newborn health commodity, SRH commodities. So the guidance provides us with the importance of being ready, and by ready, it means that the next outbreak will be a few minutes from now, a few hours from now, a few days from now, weeks or months, depending on the situation and how it might be. So keeping stock and track of the commodities and the equipment that we have within facilities help us to manage well when outbreaks occur, and specifically helps to maintain and provide MNH services and SRH services. Looking at also the condition in which outbreaks keep us in, and COVID-19 was an example where we find that facilities are in shock, health care workers are in shock, and the community is also in shock. So the response will be more reactive, but if we are more ready and we keep stock, we have a record, a proper way of keeping records of the commodities available and what might be needed or the investment that is needed, then it means that it provides health systems with a better way of ensuring that they will maintain these essential services even within an outbreak. Talking about the training that I attended, one of the best trainings I've done this year, and also very interactive learning by doing sessions. We did the training in the month of February, and I've been able to implement some of the lessons that I've learned. I did training for our team internally. Like I said, I work in a HIV prevention care and treatment program, which also has maternal and child health component within it. And we, as a team, sat down, went through some of the things that the guidance proposed, and the team was very willing to learn and willing to adopt, willing to also just try out and see how that guidance is supporting their work. I'll also finish by mentioning that from the training, my takeaway was outbreaks do not follow a linear path. So there's no way, it's better if you're prepared in advance, and there's no way you can say you are prepared if you're not implementing some of the things right now before the outbreak occurs. Thank you.
Thank you very much, Rina, for sharing your experience. It was an outstanding experience for us as facilitators as well. Like, we learned a lot being like there in Kenya and learning about your challenges during COVID and numerous other like disease outbreaks you experienced like in various regions in your country. So thank you for that. Maybe I'll go back to Dr. Sahin and talk a little bit about how can we help the frontline health workers use the guidelines. You both, Dr. Sahin and Rina, are working like at frontline level, so it will be great to hear from you and your experiences in Cox's Bazar.
Thank you, Maria, again. I think to help the frontline healthcare worker, we can do few things. Firstly, we can go for the contextualization of this document because it is essential the frontline healthcare understand how they can effectively use this guidance in their specific context. So for this, firstly, that is we can also initiate the facilitation of discussion. We can provide example that illustrate a specific, that is a need of that context, and also how it can fit with their health system based on the availability of resources they have. Secondly, for the healthcare worker, I think we can widely disseminate these two documents to the frontline healthcare workers, and we can do it effectively through organizing conference, then um, uh, online platforms or workshops, so that they can understand the recommendation and how this can be taken forward in their context. Thirdly, I would say that we also organize training for the frontline health workers, specifically designed to orient them on the contents, the recommendation, the action for preparedness, and also the response phase, and also the implementation strategies that can be basically, they can contextualize, they can understand, and they can take it in their practical implementation. Thank you, Maria.
Thank you for all these details. I just want to go quickly to Rina. In a previous discussion we had in the past, she had mentioned also apart from the frontline workers, going into a system approach, like regarding like preparedness for reproductive health in outbreak diseases, in disease outbreaks. So Rina, would you like to elaborate a little bit more on that? And how do you feel this guidance can like be like extended like outside the health sector?
So as you read within the guidance, and as Janet was presenting, there's emphasis on coordination, and coordination takes a system approach. And we can still go back to the example of COVID-19, where within the outbreak, like you say, there was a lot of past confusion, lack of understanding of how to respond well to the pandemic, which was a global issue. But again, within the health systems in different contexts, coordination mechanisms are ways that give a systems approach to the kind of interventions that we want to see as we are responding or as we are preparing for the next outbreak that might occur. And for coordination here, we mean that extending beyond players within the health sector, looking at what does the education sector have to do with messaging around outbreaks? What does the police or the security play a role in, especially humanitarian settings where you might need to, for example, transport commodities? What does the transport department also do in terms of referral system, providing proper channels for reaching the community, and also integrating this knowledge within also the manuals that we use to train our community health workers. How are they able to message information within the community, and how do they, whom do they target? So it moves beyond being a health issue and takes an integrated approach. And as we'll be using the guidance, we see more of emphasis on coordination, mapping stakeholders, stakeholders from also the nutrition department, for example, issues of food security. You could be talking to a community that you're insisting on using, for example, certain medication. I'll speak to an example back in a program where we are working on use of antiretroviral drugs, and some of the issues that come up from some of the PLHIVs is issues of lack of proper nutrition for them to be able to take their drugs on a daily basis. So how do we ensure that there's proper nutrition? And that is also, if you look at it, is an issue that goes beyond the health sector. So taking that system approach means that you understand who works where, you map, and be able to provide that as your guide in the plan for responding to the next outbreak. Thank you.
Thank you. And preparing and responding. This is great, a great answer. And I'll give the rest of the floor of this of this part of our webinar to Fatima. And Fatima, can you also come forward? Because I have something very important to ask you. And we've been together with Fatima very recently in Cape Town at the International Conference for Maternal and Newborn Health. So I want to ask you at global level, from your role and other roles as advisors and technical advisors in UNICEF, what do you feel about how we can better disseminate to other partners? I know we have IWAG and we have the READY partners, but what is your take on how we can improve our dissemination of this guidance?
Yeah, thank you so much, Maria. I think as Rina was talking about, emergencies could occur at any point in time. We are not living in the days when we used to say this country is conflict prone, this is a climate disaster prone country, but now anything could happen anywhere, any moment in time. So I would say that preparedness is key, and the dissemination is, that is one of the biggest gap, I would say, with all our global and even national documents, that they're not really being disseminated to the lowest level or the last mile, to the colleagues who are responsible for the implementation. So my humble request, or maybe to the colleagues who are even online, that let's share these documents with at national level, at subnational level, even to the facility levels also. And if you are, I mean, the documents are there, the resources are there. It's a toolkit where everything is under that document. Now, how can we make it more palatable? How can we adopt it to our own context and then share it to the lowest level would be of a great help. So every manager, every decision maker, every healthcare provider knows and understands the importance of it and can be really can do the things which they're supposed to do at the time of crisis or any situation.
Thank you, Fatima. So I'll take one message from what you said. Like everybody has a responsibility at every level to actually disseminate that. And yes, I agree. There is no there's no best dissemination plan. It needs like our own motivation, and we need to take part and personal responsibility, to ensure these documents are arriving to the right people at the right time. And especially as you mentioned, at preparedness level. I know you are also a great part of the community of ENAP, which is the Every Newborn Action Plan and the Ending Preventable Maternal Mortality Global Initiative. Do you think there are linkages between this guidance and these initiatives?
Indeed. As the recent even maternal mortality rates and also the newborn mortality and stillbirth, we realize that most of the maternal and newborn mortality and stillbirths, they are happening in countries with humanitarian context. So if we see as per the data, 64% of global maternal deaths, 50% of newborn deaths, and 51% of stillbirths are coming from the countries with humanitarian situations. So we really have to, I mean, there is a close linkage between the guidance itself, which it could play its role in reducing the morbidities and mortality both in such settings. So I see a very close linkage, and it would really help countries.
Thank you very much, Fatima. Yes, and I think it's about ensuring our extension of the minimum initial service package, especially at the acute crisis, while we're working on preparedness. And disease outbreaks seem to be a new kind of arena for humanitarian. They're always been there, but but pandemics are increasing the fragile countries, and the humanitarian settings are increasing, and people are becoming day and day more every day more vulnerable to more outbreaks. So and going to newborns and children this of course increases the issues. So thank you very much for your responses, and thanks to all of our panelists. I don't know if anybody from the panelists we have 2-3 minutes to add something before we move to the Q&A. Please step forward. I will open the floor to all of you if you want to have
Maria, I just wanted to add that beside what we are doing inside the Ministry of Health, adaptation and development of guidelines, I would also say that we need to really invest on the pre-service education side. So then when healthcare providers are being prepared, they know about all these issues, and it's somehow inbuilt into their curriculum instead of preparing them once they are on board. Of course, preparation needs would still be there, but still they'll have some basic concepts. Over.
Thank you. Thank you very much, Fatima. Rina or Dr. Sahin, would you like to add something before we go to the Q&A? Yes,
maybe I'll talk about, because I've worked closely in or so much in health financing, and some of the things we see is we would never have enough resources for financing health systems. But someone in the chat has mentioned about coordination being important, and that is a way of hiding some health costs within another department that support health to achieve its target. So if you're able to map out these stakeholders and also look at ways of especially focusing so much on prevention measures so that we don't exhaust the health systems, but also the essence is to ensure that health facilities are able to maintain the crucial or what we call the essential services that are required within a facility, even as we are responding to or we are getting prepared for outbreaks. Thank you.
Thank you, Rina. We have 1 more minute before the questions. I could Dr. Sahin, would you like to jump or yes?
Yeah, I think Maria, that is during the pandemic or this outbreak, continuation of 24/7 services and also based on the context, those are very essential. So definitely, the checklist which we has been provided in both of these guidance that will basically make sure that we are able to continue the services, SRH and both MNCSs, to make sure the mother and babies and women and girls are safe at their home. So I would say this is one of the greatest knowledge bank for our reference. Over to you.
Thank you very much for summarizing the importance of this guidance. And with that in mind, we can go into our Q&A session. We will not have time to answer a lot of questions. We already see some questions, and I would like to go to a question that came on the context of Pakistan, but I know with our panelists being here with us, we might extend the response to other contexts and share learning from other contexts and how this guidance can help you. So there is a question that that is about what steps can be taken to strengthen collaboration and coordination between different stakeholders, including government agencies, NGOs, and healthcare providers to ensure the effective implementation of the operational guidance in the Pakistani context, especially in disaster-prone regions. I'm not sure we can respond for the Pakistani context, except Fatima or anybody else wants to take this question from our panel?
I'm from Pakistan, so.
Perfect, perfect, Fatima.
I think I didn't work in Pakistan during at least in COVID time, I was not there, and even the flood time also. But the earthquake which we faced back in 2005, I was there. I would say that yes, when there is a disaster, all partners with the spirit of doing good for the people, they do come together. And we have seen in COVID times, in flood time also, partners really working together, from UN agencies to ministry, of course, under the leadership of Ministry of Health, to the all INGOs and local CSOs and everyone, they do come together. What the missing area, what I would say is, why can't we work together when there is no conflict? I mean, when there is no such situation, in the preparedness, in sharing information and collaboration. So if in one area we are seeing an outbreak, and then we can escalate, I think that is what most of the time it misses, that during the time of when there's no emergency happening or outbreak or any such sort of thing, the development sector people, they do their own job. And the humanitarian sector people, they do their own job. They hardly talk. And that is one thing which I have seen even here in some countries where I try to implement. I was conducting workshop on this newborn care in humanitarian setting, and it was surprising to see that the humanitarian actors and development actors, they don't talk. So I think they need to talk, and that's how this development and humanitarian nexus will come together. I think that's an area where we need to take some deliberate efforts. Let me stop there.
Thank you, Fatima. And I'm sure like this can be like a webinar of its own. But as you mentioned, yes, the guidance itself, the two guidances actually, they do have operational like operational options and the guidance to strengthen this collaboration. You will find like in the checklist inside the guidances, activities that you can do during preparedness, especially for coordination, how to engage like with various sectors and at different levels. So I think like you might find some responses in the guidances. You will also find some case studies from countries as examples. So I totally welcome you like to go into the guidances and look a little bit closer for more answers and we can continue the dialogue like from there through like our networks. We have another 5 minutes for Q&A. I do want to take one question about adaptation of the guidances. I know like from my own like personal like experience, especially when I was a younger humanitarian health manager somewhere in the world, like how challenging was me to understand like how to adapt some of these guidances at frontline level. So I want to ask like maybe Rina or like Dr. Shaheen or even Janet also like to share with us like whether they feel like the guidances are developed in a way that can easily be adapted, and you know any recommendations you have to give like to the people we have here in the webinar. Rina, any thoughts from like Kenya after the training?
So adoption of the guidance is a process that requires, first of all, to communicate to who are the users of the guidance. And in this case, you'll find the users are health. Someone has asked about who, is it only for healthcare workers? But as you read the guidance, you'll be able to see that it's not restricted just to healthcare workers. Anybody working within the health sector might not be direct as the providers, but within the health sector, the guidance is important for them to be able to do it. If I may quote an example from Kenya, during the COVID-19 peak, there was a policy that was developed by the Ministry of Health, specifically talking about how to maintain sexual and reproductive health and maternal and child health services within COVID-19. And there were like a policy document talking about the various things to do, to be adopted by facilities in order to ensure that these services are provided. While you read that was specifically within that context, but now the guidance has provided a wider checklist. And this is not more of reactive or responsive, it's more of proactive, where we are looking at preparedness before the thing happened. When you look at the policy that was developed in my country, it was responding to an outbreak. But if you read through the guidance that have been launched today, they are giving insights on how we can prepare. And preparedness gives us room to be able to even save on resources, because we'll be able to have a checklist and look at what do we have, what do we do? Have we trained our healthcare workers on how to respond to outbreaks? Have we enough PPEs if you need them? Do we have enough commodities? How do we manage our human resource so that they are not exhausted? Because we already know that human resource in the health are also not enough. So how do we make use of those that are in existence? How do we find ways of also making sure that their mental health is kept well? So it's very, it's holistic, looks at all round. And if a country wants to like adopt it, I think it's, it provides a global view of the entire health system, responding also to the WHO building blocks for health systems. Thank you.
Thank you, Rina. Thank you, Rina. Yes, that was a very important overview. We have limited time, and I wish we had more time for Q&A. Yes, Dr. Sahim, would you like to add on this?
Yeah,
Yeah,
Maria,
go ahead.
about that is even that is the adaptation contextualization is a continual process, and that is every context is different. So still we can provide the technical support, and it can be through expert consultation, webinar, mentoring programs, and that specifically will address the question and challenges during the implementation process, and that would in fact reinforce the application of the guideline. Additionally, we might encourage to the health worker or who is using this guidance to provide feedback, and we can collect those feedback and incorporate those suggestions to improve the clarity of this guidance, applicability, and also usefulness for the future. So I think we can follow these kind of approaches to make it more context specific to meet the need of the vulnerable of that context. Over to you, Maria.
Thank you. Thank you very much again for this. And I want to extend also that Dr. Shaheen was one of the main contributors in the guidances. So he has a deep understanding of the content together with Janet, along others in this group of panels. So thank you for adding this. And I'm going to close the Q&A now. There was one question about how we do advocacy for donors. That's very interesting. We will try to type some answers, but I want to also reinforce that sometimes technical documents, especially when they are operational, they can also serve as advocacy tools. So we've been to conferences, we are sharing this with you. This is a tool you can take to donors and actually reinforce your voice about the need to prepare for reproductive health before and during the response phase in disease outbreak. So with that, I'm going to close the Q&A session. Thank you very much for your participation. And I will pass the microphone now to Janet to close this fantastic 1 hour with all of you. Thank you very much. Janet, the floor is yours.
Okay, thanks so much, Maria. And a big thank you to you and the panelists for, I think, a super rich discussion about how these guidance documents might be applied and used in different settings and how they've already been used. Maybe some key points that I took from this was how critical it is to incorporate preparedness into development and humanitarian programming, that really is where humanitarian development nexus activities should be, or one of many should be. Another key point was how critical it is to disseminate the guidance at all levels, to the frontline health workers with orientations as needed, to managers, to implementing partners, to government leaders, that these can be taken up and used as a guidance at all different levels. That outbreaks are not a linear path, and so we need to be nimble in the way that we respond to outbreaks. And that the checklists are a useful tool for really quickly looking at what needs to be done, how to prepare, such as, ensuring you have enough PPE once you know what the outbreak is, etc. So I think Laura has already shared the documents. She might share them again in the chat box so that you can easily access them. And I wanted to mention too that there will be 2 trainings in Cox's Bazar in September. And then there will be another training, and we have not determined what location or date that will be. But information will be shared through the Ready website and different channels once that training site has been selected. And I would also just like to highlight that Ready has a couple of really useful resources. You can go to this link for the Ready Resource Library. It has multi-sectoral tools and guidance for outbreak readiness and response. You can search by topic, disease type, resource type, author, or language. And there is also a Ready Learning Hub for those of you who would like to check out e-learning opportunities. There are 60+ courses that have been curated from Ready, WHO, UNICEF, and other partners. And there's innovative outbreak simulations that you can play. And most importantly, all courses are free. So we encourage you to take a look at those. And so just in final wrap up, I would like to thank all of you for joining us. I know there's a lot of things that are competing for our time. So thank you so much for joining this webinar, and please be in touch with us anytime if you have questions or have any suggestions or feedback or need any support that we might be able to provide virtually. And a big thank you to BHA for supporting this work. Thank you all and have a great rest of the day. Bye.